Chapter 10, Fat-Soluble Vitamins, Part 2, Martha Olson. Looking at vitamin D, we know regular exposure to the sun will help synthesize or make all of the vitamin D that is needed, but there is variability in the amount of sunlight throughout the year and the amount of sunlight that is able to be synthesized depending on the skin of the person. A very light-skinned Caucasian is going to synthesize more vitamin D than a dark-skinned person that has more melanin. We know that bone health and decreased risk of cancer, colorectal cancer, are attributed to vitamin D intake, prevention of osteoporosis and fractures in the elderly, as well as bone development and growth in children. Vitamin D is very much needed. Infants are born with about 9 months worth of vitamin D stores in their body. So it's important at about 9 months, as growth is really taking off, that there is enough vitamin D in the diet. Sunlight exposure, depending on the time of day, between 10 and 2, there is obviously more sunlight and vitamin D that's being absorbed. The season, the environment, type of sunscreen that's used, and then age, because we know synthesis will decrease with age. So our elderly are more in need of dietary vitamin D because they will not get as much from the sun. So again, our rickets are also called bow legs. We see this in children that have a deficiency to vitamin D or a very poor diet. The risk of osteomalacia, or softening of the bones, is higher in people who have diseases that affect the stomach, kidneys, gallbladder, liver, and intestines. Those that use a lot of sunscreen to prevent skin cancer are going to synthesize less vitamin D from the sun. Our older patients, older than 65, have a 4 times decreased ability to produce vitamin D, and so getting the elderly out in the sun for some vitamin D is going to help some, but a very limited amount as they age, and that's because of the changes in the epidermis. Most younger people store enough vitamin D during the summer that it kind of gets them through those long winter months if you live above that north of 42-degree latitude. And we can get some toxicity, but not from the sun. Really, the only way to get a vitamin D toxicity would be from supplements. A condition called hypercalcemia affects the kidneys, and where it's not concentrating urine, it deposits that in the soft tissues. We see central nervous system depression and loss of bone mass. When we look at some of the cultural aspects of vitamin D, we know Arab women who are clothed so that they are not exposing any of themselves have a decreased exposure to the sun and have more vitamin D deficiency because of the less absorption. Vitamin D, the big thing to remember about that, vitamin E, is that it's an antioxidant and it protects the cell membrane from the free radicals. So it's kind of like a cancer prevention or anti-aging. It helps kind of like keep everything on the inside healthy. Tocopherol is from the Greek word tokos, which means childbirth. Ferol means to bring forth, and the end of that word, the ol, or the suffix, is alcohol in nature of a molecule. The absorption of vitamin E requires adequate dietary fat because it's a fat-soluble vitamin. And as we look at the word free radicals, you've probably read about that in the newspaper or news. We know that free radicals is a term that is used a lot with cancer. The oxygen reacts with compounds making these free radicals, which are unstable toxic molecules that contain one unpaired electron. So that electron is kind of wild and free out there doing its thing and bumping around, causing damage to the tissues. Unpaired electrons make free radicals very highly reactive, and they attack and steal electrons from other parts of the body, and they set the stage then for many of our chronic diseases such as cancer. Vitamin E donates that electron to the electron-seeking free radical, preventing aging and instability and decreasing your rates of cancer. So vitamin E in the diet is important. We get it from many food sources, including our sunflower seeds, nuts, wheat germ. Our oils, margarines, and salad dressings also have a good amount of vitamin E in our diet. Strawberries and green leafy vegetables are also very good sources of vitamin E. With cooking, processing, and storage, it decreases the amount of vitamin E. So again, the more natural form that you can eat the foods, the better enhancement of the vitamin E you would consume. Milling of wheat, we know that the wheat germ is removed and that removes the vitamin E, so eat whole wheat bread for more vitamin E. And chloride dioxide in bleaching of white flour, our vitamin E is lost, so that's where eating whole wheat bread does give you the benefit. Oxygen is the destructive culprit that attacks vitamin E, causing it to break down and not have its properties be able to be used. Most of our deficiencies in vitamin E come from fat malabsorption syndromes such as a cystic fibrosis patient. And when we see the word hemolysis or the deficiency of, that's the breakdown of red blood cells. Without vitamin E to protect our cells from oxidation, destruction of the cell membrane is rampant, and we see where the red blood cells then burst, causing a hemolytic anemia, oftentimes in premature babies, if there was no vitamin E from the mother because they were born too early. Vitamin E inhibitory effects on platelet adhesion help to decrease heart disease. Supplements do, however, interfere with vitamin K or the blood clotting function of the body, so finding the right balance is important. Talking about vitamin K then gets us to the fact that it's very important for blood clotting and formation of bone. When we look at blood clotting, there's that clotting cascade from the production of proteins and the protein fibrin. And so having protein in the diet is also important to making blood clots so you don't hemorrhage. 4 of the procoagulation proteins in the cascade are vitamin K dependent and require calcium for activation. So again, when we talk about the interrelationship in our vitamins and minerals, they can't work alone. They don't just do one thing. They kind of help each other. The association of more fractures and decreased levels of vitamin K in the blood have been noted. We need about 400 micrograms per day. As with other fat-soluble vitamins, vitamin K needs dietary fat to be absorbed. And any plant sources and bacteria in the colon are good sources for vitamin K. We look at vitamin K also when we look at patients that are taking Coumadin, which is a medication to help decrease the clotting time for a person that has like atrial fibrillation or they've had heart problems. And so the interference of certain medications for vitamin K is important to know. A family member came home from the hospital on a Coumadin and nobody had even mentioned diet with vitamin K and how that interferes with the Coumadin. So as healthcare providers, understanding these vitamins and how they work with many of the medications is going to be essential for our teaching of the patients. Deficiency is very rare with vitamin K, and again, excess can interfere with that anticoagulant medication. Prolonged use of antibiotics may cause a deficiency because the drug destroys that intestinal bacteria that make vitamin K. So vitamin K is made by the bacteria in the colon. That's why your newborn baby gets a vitamin K injection as soon as it's born so that it doesn't hemorrhage because the gut or the colon is sterile. People on antibiotics where it wipes out not only the the bad bacteria, but the good bacteria also are at risk for a vitamin K deficiency. For the anticoagulant teaching, anybody on, like your heparins or Coumadins need consistent pattern of vitamin K. Once we get them regulated on that anticoagulant, it's important for them then to continue that same pattern. I think of patients I've cared for that don't eat as many vegetables, that deep green vegetables that have a lot of vitamin K in the winter. It gets to be springtime and they, hunt asparagus and they've got many like lettuce and spinach in the garden and they consume more of those types of foods, and that's when their blood levels, their protime levels change, causing problems with blood clotting. With our newborn babies, again, they get the vitamin K injection at birth, and our toxicity is called a hemolytic anemia. So looking at our vitamins in an overview, we know that all types of foods contain vitamins. Our provitamins are those precursors that the body then converts to an active vitamin form. Growing conditions, storage, processing, and cooking all affect the amount of vitamin in the food. And we know that there's been a lot of understanding of some of our diseases now and how the vitamins have an interaction with that. Mucous membrane integrity contains a higher percentage of goblet cells, and as we look at our retinitic acid, fewer stem cells become goblet cells, and these then become hard and scaly. With vitamin A and our vision, we know that vitamin A deficiency can cause temporary blindness, night blindness, and it is reversible. But if it goes on long enough, it will become a permanent night blindness for that person. As we look at osteoporosis, that lack of vitamin D in the diet, so it's very important for young people to get enough vitamin D rich foods in the diet to lay down that strong foundation or lay that matrix strong so that that bone through the growing years when it is getting its strength has all of the benefits that it can. After age 30 then your bones don't gain any strength or matrix, but you hope to just continue to keep them at the same level without having loss of bone or osteoporosis. Again, free radical damage was talked about with vitamin E, and that is damage to cell membranes, and that's from that damage from the proton that is not fully. And our vitamin K and bone health are related as we look at osteocalcin is an abundant bone protein, and it is required for the bone to be mineralized and mature. And vitamin K helps in the calcium binding properties. So as we look at many of the vitamins, the interplay with many of the health and issues that we have with prevention of disease and also having immunity against cancer and other chronic diseases.